For the past couple of weeks on the Reality Check report, I've been covering a litany of different topics, ranging from the poor job market to the housing crisis we're experiencing here in America. But in this video specifically, I'd like to show what's happening in the medical industry, specifically with doctors. You see, many doctors and physicians are leaving their jobs right now due to a litany of reasons. And I want you guys to really pay attention to the various reasons why these doctors are leaving right now. I'll come back at the end and I'll talk about what we can expect to happen in the next up and coming decades. Let's go ahead and roll these clips.
Doctors aren't just burning out, doctors are walking out. The US could very well be short about nearly 90,000 doctors, I think, by year 2036. Doctors are not quitting because they don't care. They're quitting because they can't keep up. We can't keep carrying in this broken system. Insurance denials, endless paperwork. Outpatient docs have like 15-minute appointments to fix lifelong problems and laws that keep changing. How, when, or if they can treat. It is too much. When doctors leave, who's going to speak for the patient? And this is why physician-led advocacy exists, to rebuild that bridge between medicine and meaning. Because if doctors can't stay in the system, we'll stand beside it for the people still inside it. We're not burnt out because we stopped caring. We're burnt out because we actually still do care.
Guys, this is Alina. I'm so sorry to do a video crying, but I just wanted to just record this moment. I am a new hire with LabCorp here in Seattle, Washington, and I'm at my second location because my first location I underwent bullying by the lead there, and I am now at a second location that I really liked. However, I am being mistreated by the phlebotomist here. Her name, well, I'm not going to say her name, but I'm being mistreated here at the James Tower location. And I've never worked for an employer where I've been bullied by my coworkers or by a superior. I'm in training, and I've been going through this for a month and some change, and all I want to do is learn and grow in the company and help others, and it's been a terrible experience, and I wish this on no one who comes after me. But it's really an issue. It's a really an issue. And it's unfortunate. So I'm not sure at this point, I've already gone to HR. And I've reported both instances. I've been in touch with my supervisors. But at this point, it's unfortunate. I'll most likely have to leave because within this organization, they have people that don't want others to go forth, and they don't really care. But there's people like me who are driven, who are ambitious, who want to help change the world, and just help advance the health care field. But anyways, it is what it is. But I just wanted to record this moment. Today is April the 28th. It is 11:02 a.m. And one of the reasons why I am out here in this lobby is because the phlebotomist that I was in there with, she started yelling at me in front of patients and just popping off. Extremely disrespectful, and threatened to send me home. Those of you guys who know me, I am not confrontational at all. I had simply asked her if she could not speak to me in front of patients that way, and she went off and she was threatening to send me home. She's not even my supervisor. So anyways, but I just wanted to let you guys know that just keep me in your prayers. But unfortunately, I really loved working here at LabCorp, but I can't stay here because of the kind of people that work within these facilities. And unfortunately, everyone's not. Let me just say this: there are some good people who care, but it's really hard when you have people in positions that are over people, or when you have people that feel entitled, or they feel like they've been with the company for a long time and they can talk to people or treat people any type of way, especially without regard for even the patient's experience. It's really wrong. And so I just want to just let you guys know, I've been a champ. I've been like, I'm not no quitter, but y'all, I can't do this anymore. I have to be in a work environment where I'm safe, and I am not a person who's overly sensitive. Am I a crier? I could be a crier at times, but I'm very strong and I'm very resilient. But I know when to leave, and this is my time to leave. I know when I need to be and when I need to stay. This is a situation where I'm going to need to leave, and it's unfortunate.
This is wild. The American Medical Association did a poll on U.S. physicians. 40% said that they would leave their jobs in 2 years if they had the financial means of doing so. Think about this for a second. Imagine that almost every other person lost their doctor in 2 years. Think about that. It's nuts. It's nuts. I don't know. I think it could be a disaster. Could be a huge disaster. Why is it like that? Because the job is exhausting. It's just exhausting. I am leaving the hospital right now. I am exhausted.
Okay, do you want to know why people are quitting medicine? I'll tell you what. I'll tell you what happened to my clinic today, and maybe it'll give you a glimpse of what's going on. I'm an orthopedic trauma surgeon. My name is Dr. Neelafar Dagan, and I had a very difficult clinic today. I had a patient that I operated on, and he had a bad complication, and I took the time. I had to sit there with him, explain to him what's going on, go over his results, go over our plan, what we're going to do, answer all his questions. And that takes time. And that's my job, to get my patients through a difficult scenario or when there's a complication. And after that interaction, I felt really bad, because I genuinely feel bad about my patients when they're not doing well. And right afterwards, I had to see another patient who, at this point, I was running behind because I had to spend so much time with my patient with a complication. So obviously I was late to this other next patient's appointment. And this lady was just so bitter and so unhappy. She just, the whole time, she was just saying how, I don't know why I'm here. Why am I here? Why am I seeing you? I'm wasting my time. And I tried to explain that, well, you had a hip fracture and I fixed it, and these are your x-rays, looks like you're doing well. And not only was she so ungrateful, but she made me feel like absolute crap. She basically said she hopes she never has to come here again, that I completely wasted her time, that it was completely worthless for her to come to clinic today. And while I can appreciate her being angry because she had to wait an extra half hour to see me, for you to berate me like that and treat me like that, I just can't take anymore. I have patients who come that I've helped through difficult times and they're grateful, and I have patients that are not grateful. And to be honest, I go to work every day, I do my job, I fix patients' fractures, I help them, whether they know it or not. For you to come to clinic and say it was a complete waste of your time, you hope you never have to see me again, and not acknowledge the fact that you had an injury and I fixed it, and I don't even need thanks. I just need you to treat me with some respect, like basic respect that you would give your air conditioning person who comes and fixes your air conditioner. Pretty sure you wouldn't yell at them out the door and say you are ungrateful, you hope you never have to see them again. At least have the courtesy to say thank you, or just not say anything at all. But for you to come and yell at me and scream at me when I'm trying to do my best, I just can't take it anymore. And I couldn't take it anymore. I basically, I left my clinic. I just, it's just so difficult being in medicine these days. There's so many pressures. on you from the hospital, the administration, the patient's family, my own family. I'm trying to look after my own children and my own family. And it's just nice to be known that people appreciate what you do, or just be neutral, but just have some common decency. Don't go to a clinic to a doctor who's treating you and be rude. I mean, it's just common courtesy. So, thanks for listening.
Hey y'all, it's your girl, Dr. Kimmy, and today I want to share with you why I quit my job as a physician, why I no longer practice medicine, what I'm doing now, and why it was the best decision I have ever made in my life. So I was a pediatric hospitalist. I still am. I'm double board certified. They'll never be able to take that away. But I quit my job and I am now full-time in my business because while I've always wanted to help people, medicine no longer provided me with the autonomy and the sense of purpose that I was yearning for. I felt like I was just a warm body in a white coat. I was just there to make money for the powers that be, rather than me actually fulfilling my purpose. I was also a victim of workplace discrimination, racism, and why put up with that when I can start my own business and do my own thing?
My name is Frances May Harden. I'm a 33-year-old ENT surgeon, and I'm leaving medicine for good. No one would ever become a doctor with the intention of leaving medicine. We even see this modeled for us where surgeons operate well into their 70s, and even then somebody has to pry the scalpel from their hands. But for me, over the past 10 years in training and in practice, the disillusionment with medicine has been too great for me to stay. All of us know what it's like to be in the wrong situation, the wrong job, the wrong relationship, and so many of us stay really a lot longer than we know we ever should have. Because it's hard, it's scary. And I had an inkling that this was not right for me when I was a junior ENT resident. But the thing is that back then, I was not brave or creative enough to leave. So I just kept my head down and I finished training and went on to become an attending. The thing about becoming a doctor is that by the time that you realize it might not be the right fit for you, you've already put several years, so much time and effort and sacrifice into the career. It's very hard to leave. I'm making this announcement for every person who's ever felt guilty for even for a moment questioning or doubting their profession. And I'm excited to announce that I've changed. I'm brave and creative enough, and so I'm leaving.
40% of doctors are considering quitting practice. I was one of them and actually left the overlords of the medical industrial complex. Here's why. Hi, Dr. Brian here, retired physician and founder of Health Without Risk. I came across a thread on X this week that should be interesting for anyone whose doctor just up and quit. It captures why the medical system is collapsing from the inside out. Here is the post verbatim from creator Chris Betcher. Quote, "A friend told me recently that his wife, who's an MD at a major local hospital, is seriously considering leaving medicine. Not because she stopped caring about patients or long hours, but because of the pressure from above. In her system, every diagnosis comes with the expectation of prescribing the drug that matches the code. If she doesn't, she gets questioned, evaluated, sometimes even financially penalized through performance metrics tied to quality measures. This sounds noble, but really just means, did you give the patient the medication the system expects? He said she's been dealing with it for a while and it seems to get worse every year. She didn't go into medicine to be a cog in a pharmaceutical machine. She went in to actually help people. But the hospital's incentives don't reward lifestyle coaching, nutrition conversations, movement prescriptions, or digging into root causes. There's no bonus for helping a patient reverse insulin resistance. But there's plenty tied to metrics on prescribing statins, those shots, antihypertensives, SSRIs, and anything else that fits neatly into a billing code. And the saddest part, this isn't rare. Between pay-for-performance systems, pharma influence, and hospital revenue structures tied to drug utilization, The entire system nudges doctors away from thinking and toward prescribing. Many MDs feel trapped. If they want to practice slow, thoughtful medicine, there's no time. Or if they want to focus on root causes, there's no billing code. If they want to avoid unnecessary medications, they risk being flagged for not meeting standards. So many of the good doctors are quietly slipping away, and we wonder why chronic disease keeps rising. A system that incentivizes prescriptions will always produce more prescriptions. A system that rewards dependency will always create more dependent patients. And a system that punishes critical thinkers will eventually lose all of them. My friend's wife isn't leaving medicine, she's being pushed out of it. And until we fix the incentives, she won't be the last. Unquote. Those reasons aren't just statistics. They are some of the same reasons I left clinical medicine in 2017 after 30 years as a practicing physician. The problem wasn't the patients, it was the system. When a doctor is forced to spend 2 hours clicking through electronic health records and fighting with insurance companies, that's bureaucracy. When a medical board threatens your livelihood for practicing functional medicine, that's scrutiny for thinking outside the box. The burnout is not from long hours, it's abuse. The moral injury of watching a system prevent you from delivering the comprehensive care that your patient, especially those focused on aging well, truly needs. I saw this coming over a decade ago. Back in 2013, I wrote an article for Kevin MD called "The Beauty of Direct Pay Physicians." I argued back then that when you strip away the insurance middleman, the doctor and the patient finally form a true cost-effective partnership. This model eliminates the administrative bloat that creates burnout and abuse, giving the doctor the autonomy to treat root causes, not just symptoms. That was the promise and is the promise of direct primary care, and it's what continues to draw physicians out of the broken system today. This is not just about sad doctors, this is a patient crisis. The system that pushes doctors out is the same one that denies you preventive, personalized medicine you need to manage your health as men and women age. I want to know what you think. If you've seen a doctor leave their practice, what was the reason? Let me know in the comments. And if you're a doctor or a nurse who has left, what was the final straw for you? Like and share this video, and remember to subscribe to or follow Health Without Risk, where we explore options for better health you won't hear from mainstream medicine. And join my Health Without Risk bulletin board from our profile page, and join me live at noon Central Standard Time Monday through Friday to discuss my shining protocol. Thanks for watching. Bye.
This is Dr. Muhil Ravichandran, and she's being kicked out of the United States, which is insane because she's been here legally since she was 2. She has a doctorate from Rutgers University. She works in cancer research. Like, if you were to make a list of all the people I'd rather see leave the United States, 99.9% of people would be above her on that list. Wondering why so obviously promising a person is being forced out of the country? Doesn't matter how smart she is, she ran to this. This is a chart of the various legal ways to get a green card to stay in the United States legally and permanently. You see, when she was a child, she was covered by her family's immigration status. When she was in college, she could get a student visa. But as soon as she's out of college, she has to get a green card herself. And there's the rub. It's because she's from India, which has some of the longest green card wait lists in the world, about 17 years on average for an undergrad degree holder, and as much as 151 years wait if you have an advanced degree beyond that. Now, there is a way around that decades-long wait. It's called the H-1B visa, which is sponsored by your employer. So Muhil got a job with an oncology center, a cancer research center, and applied for an H-1B visa. But the problem there is that there's only 85,000 H-1B visa slots each year and nearly 500,000 applicants. Fewer than 1 in 5 applicants won the H-1B lottery, and that did not include Muhil. It's always silly when immigrant entrepreneurs, inventors, and scientists are turned away because of the flaws in our immigration system. But it's particularly sad in the case of Muhil because she does biomedical research. You might not know this, but the key bottleneck for all kinds of breakthrough medical research right now is labor. It's people who have the skills and talents and education to do this kind of research. There's not enough of them. So when people like her are pushed out of the country, it doesn't mean someone else just takes their job. It means we do less cancer research, period. And that's particularly crazy right now because we are on the cusp of incredible breakthroughs in cancer research and treatment. There are vaccines for cancers like lung cancer, breast cancer, prostate cancer, melanomas coming down the pipeline right now. In the middle of our war on cancer, we're kicking out the soldiers, the people fighting for us. We should be begging folks like Muhil to stay rather than making them pray not to have to leave. In terms of policy, what should we do? Well, at a bare minimum, we need to raise the H-1B visa cap. We should flip that ratio on its head. Instead of 4/5 being excluded, 4/5 at least should be accepted. Remember, these are the best of the best, the brightest of the brightest, inventors, scientists, medical researchers. Let them stay.
You know, in these videos that we just saw, there were many different reasons why doctors are leaving their professions. And obviously, we know that to become a physician, a doctor, a surgeon, no matter what practice you're in, it takes many years of education, dedication, and so on. I just want to talk a little bit about the various reasons that we've heard in some of these videos and why this can become very problematic over the next couple of years. See, one of the doctors, in fact, many of them, discuss their disdain for how they're being burned out at the job. They're working many hours across the board. You know, doctors, especially resident doctors, are working upwards of 12 to 16 hours per day serving patients. And when you have so many patients who need treatment, some of which are not in the best of moods, that's enough to physically and mentally burn you out. And I can definitely feel them on this. And obviously, they're also not working in the easiest of industries, being the medical industry, because not only do they have to deal with strict regulations and they have to play by the book, so to speak, but there's also a lot of corruption in certain parts of the industry that they have to deal with and they have to avoid in order to keep their licenses. So there are many, many reasons why I personally can understand what they're going through. Another thing that we heard is a lot of the workers are being mistreated by others, whether on basis of race, skin color, religion, background, or just overall general mistreatment of certain workers. Like the young lady in one of the videos talked about how she's been working with a phlebotomist and she's being mistreated every single day. They treat her disgustingly at work. The only thing I would ask is, if you're being treated so poorly, instead of crying, why do you stay there? And again, it could be that she's staying there because she really wants to gain the experience and this is probably critical for her future in the profession. But me personally, I don't know. I just have way too much pride to stay in a place where I'm being mistreated. That's just me personally. And I understand that many people may feel differently about that, but I personally would definitely not stay, especially when she has so much to offer. She may be a new student and she may be new to the profession, but in the next 5 to 10 years, she could be saving lives. So that's another reason why I think people in this profession should be highly regarded and not mistreated. Now, another thing that we heard was the Indian doctor who has been in the States since she was 2 years old. And now she's a fully grown adult and she's being sent back to India because of a mishap with her green card as she was transitioning out of medical school into the profession. And that's a real shame because she was studying cancer research. And she's definitely someone who can contribute to society. And now she has to give up everything she knows about America. She's practically American. She grew up in the United States. She probably has an American accent. And now she has to go back to a country that she doesn't have much familiarity with. Maybe she's been on trips there, but she's never lived there long term from what I've seen. So that's really hard to swallow. Like the fact that you have to give up everything to go back just because of a Trump policy change. And it's kind of crazy. But again, could we really say that it's Trump's fault, or is it just the failure of government in general, whether Republican or Democrat? That remains to be seen over time. Now, one other thing that I've noted here to discuss is that we overall in America, we have a broken healthcare system to begin with. And obviously that leads to burnout of the doctors and physicians who work in this profession. You see, because our system, for example, I've heard several stories where doctors talked about how they don't get payments or for claims, right, from patients because of certain health insurance policies from certain companies or certain carriers. And for example, a common thing that happens in the States is no matter if the person has an HMO or a PPO plan, they go to a doctor and they seek treatment, and the doctor says or asks the question, well, which carrier do you have or provider? I have Aetna. Sorry, we don't take Aetna. There aren't many countries in the world that do that. Guys, I'm being 100% honest. That is a specific American problem. The fact that I have healthcare doesn't mean much in America because at any time a physician can simply say, we don't take your plan. We only take plans from this provider, or we don't take PPO, we take HMO. You have to be in network instead. And then there's the whole in network versus out of network thing, and that becomes a whole nother conflated issue. So in general, I understand from the doctor's point of view, the fact that they can't get paid from insurers if the patient has a certain policy or from a certain provider. It doesn't really make any sense to me. So now you have physicians who are saying, I take cash only. And obviously, most Americans cannot afford to pay cash only out of pocket for coverage or for treatment. And that seems to be a big problem across the board. And I really wish that we just took a step back because I was reading something a while ago, and this is quite relevant to what I'm saying, where they said that if America actually took the step back and revamped their healthcare policies, they would save trillions of dollars per year. There would be trillions of dollars more profitability if they were to rearrange the way that healthcare is delivered and administered between providers. And even if there was a single payer system, the government wouldn't really be heavily paying the cost of that because a lot of that will come from the taxpayer. We're coming to a point right now where Americans are starting to see the value of having solid healthcare and solid doctors. Now, what do you guys think is going to happen in the next 5 to 10 years if doctors keep leaving the profession? What do you think is going to happen? I mean, these doctors are going abroad to Europe. They're going down to Mexico. Do you understand how many stem cell clinics, for example, are open in Latin America and they're all owned by American doctors? Do you guys understand that? It's like a ridiculous amount. And unfortunately, these doctors, when you hear their stories, because many of them publish their stories online, they also always talk about, well, I was tired of the way America does healthcare and I wanted to do healthcare differently. I actually want to help my patients. I don't want to rip them off. And this seems to be a recurring story across the board. So there's no telling how things are going to end up. I can tell you 100% though, that if nothing gets fixed, we're going to have an even deeper shortage of medical care professionals. We already have a very huge shortage, guys, and now we are running into the doldrums of the number of available doctors in the country. And then you look at other countries like Canada. Yes, Canada has problems too because they have very little doctors available, but at least there, the problem of these doctors not getting paid doesn't exist because there's a single payer system called Medicare, ironically, in which doctors get paid directly from the government. And then you can elect to have private health care pay for the additional incidentals. So again, our system is totally broken. And I think all of these points that I mentioned, ranging from the mistreatment of people to the broken system to the racism discrimination, all of these points are somehow intertwined. You know, they're deeply intertwined with one another. And we're seeing the utter destruction of the healthcare system in America, if it even existed to begin with. So I don't know. I think that we just need to stay healthy as possible. Really focus on eating the best foods, focus on exercising if you can. If you don't like to do aerobics or lifting weights, Go for walks. Make that a regular habit. Just walking a few minutes a day will do you very good. And try to get a physician that you trust and hold them close. All right, that's very important. Make sure you go to a physician that you trust and hold them close and show them appreciation. It doesn't hurt for you to bring them some gifts. If they're doing a good job for you and they're taking care of you and they're doing the right thing by their patients, bring them something to show them appreciation, because they can be here today and gone tomorrow. Well, guys, go ahead and like this video if you like what I just talked about, as well as what you just saw. Make sure you subscribe to this channel and show me some love. And YouTube believes you'll like this video right here. Go ahead and give that a click, and I'll see you on the next one.